Thank you. Thank you, Danielle, for the introduction, and thank you guys for inviting me to this talk and to GDMI meeting. Just give some brief over. I'm from Mission Neuroscience Institute. I'm from Dr. Suzhang Science Lab, which runs the intern health study. And today I'm just going to give a brief overview of what we have done with the mobile data over the past years in the mental health studies. Hopefully this could give you guys a bit of insight of what it looks like and inspire more ideas among people who are interested in using the mobile data in the research. I'm happy to answer any questions. You can stop me anytime whenever you have any questions. I'm gonna give some brief study overview first, and then go on with some specific applications that we have been doing, and maybe discuss a couple common issues that we have seen in our studies. And for the overview, just a brief introduction of the intern health study for anybody who's not familiar with it. We followed the first year medical student residents around the US in their first year of residency, which is a very stressful environment and could elevate their depressive symptoms level and the overall depression rate. And so that makes the first year residency a stress model where a bunch of people were experience the same stressor for a period of time. So the study recruits the residents in the spring after their match, and send them email invitations and ask them to download an app. And the interns finish the baseline surveys, collecting some general demographics, psychological factors, some information about their residency and their depressive symptoms measured by PHQ-9 scores. We also send them the wearable devices, the Fitbit, or if they already have Fitbit or Apple Watch, they are eligible to enroll, and then collect their saliva DNA data. And their internship usually starts at the beginning of July, and after that, we follow them for the whole year. The quarterly follow-up surveys estimating their PHQ-9 scores and their working conditions, life events for every 3 months, but also on a more granularity basis. Every day, their wearable devices collect their measures related to their physical activity, sleep, heart rate, with a minute-by-minute granularity, and also on the daily level summary measures. They are also reminded to submit a mood score, usually at the later day, on a daily basis. 1 means the lowest mood and 10 means the highest mood. And we found that the mood is highly correlated with their depression scores. So intern health study itself started back in 2007, but the study started to pilot the wearable data collection since 2014, first just within the hospital, but then started the large scale collection since the 2017 cohort. Each year, this is a data flow graph that was, I think, made by Courtney, our coordinator. I think she's here today as well. So our data is collected through the intern app that is developed by a third-party company. Sometimes it's a customized app. Sometimes it's a app based off the platform of that company's a general app. And the interns wear the wearable have the wearable devices and submit the survey data through the app, and the survey data will be delivered to the app, and their mobile data will be collected by Fitbit or Apple Watch Health Kit database, and the intern app will extract those mobile data through the API. Interns will get some data feedback, like plots or some messages through the app. At the same time, this data will be transferred to a university maintained database. And our local team will also keep a copy in a Dropbox and for doing the data analysis. And also share the de-identified data with some of our collaborators, do some further analysis. On the right-hand side, you can see like a screen of what the interns sees every day, like on their apps, some feedback plot of their sleep, steps, and mood data. So I'm going to talk about some specific projects and applications we have done for this past few years. So far, we have utilized the mobile data into various types of applications, including some association tests and some tests adding the genetic moderators components, and some micro-randomized trials testing the intervention effects. There also are some studies estimating the circadian phases and parameters, and a couple cases related to COVID detection. So the first, I'm going to start with some most straightforward association tests. This one is done with some of our pilot data that we collected back in 2014, 2015, just to look at the association between daily sleep duration, steps, and mood. We did some paired t-tests and linear mixed models and found that interns had significant drop in the mood, sleep duration, and steps after the intern year started. And also the mood and step, mood and the sleep both have bi-directional positive associations, like the last night's longer sleep or more step, or in the daytime, the more steps will give you a higher mood, and higher mood will lead to longer sleep and more steps afterwards, but vice versa. This also shows some circular plot just to look at the sleep timing change after internship started, and the darker bars are the internship timing, and obviously looks is much earlier than before internship, and it's mostly driven more by the earlier wake time after the internship started. Also, we did some association tests, just looking at not only the amount of sleep, but also to look at the consistency of the sleep, or the sleep variabilities and these association with mood and depression. It is done in a much larger samples, about 2,000 subjects from our 2017 and 2018 cohorts. This graph is just showing a study flow diagram, just listed every step from enrollment to analysis. I'm listing this plot here just to want to mention this handy plot sometimes, just to explain every single step of your study design, especially if you have a mobile data components that makes your study more complicated. Such a diagram makes it very easy to explain more than text. In this study, we found that the sleep variability also has associated with the mood or depression. On a yearly summarized level, the interns with higher PH9 scores have more variability in total sleep time, in their variation of bedtime, and bigger variation in their wake time. On a daily basis, we also find that if you have a bigger difference in your sleep time duration or your wake time timing from your last night, it will have a negative impact on your daily mood. So then there are also some studies with adding some genetic components. The genetic moderator we have been used are the polygenic risk scores. Simply put, it is a weighted sum of effect allele counts of many genetic variants of one subject, resulting in a single score for each person, indicating their genetic predisposition of a trait. Could be a disease trait, could be a non-disease trait. It usually has a normal distribution among people. Adding these components just give us some even more deeper insights into some precision health perspective to see maybe some association we found may only apply to part of the population, but not applicable to the other part. Here, this is one project has been ongoing. It's just to look at the relationship with between the exercise and depression. We use the active minutes measured by Fitbit to be an indicator of the exercise time. And the genetic moderator here, we use this MGD-PRS. We used an emulated randomized trial design to estimate if all subjects exercise within a range of total time weekly for a total of 9 weeks, what will be the average PHQ-9 score at the end of the 3 months, like the Q1 PHQ-9 score. We found that more active minutes are related to less depressive symptoms, but when we separate them with higher by 2 groups with by the MGD-PRS scores, we found that this relationship only exists among lower MGD-PRS subjects. Another interesting small side project that is to look at some response to daylight saving time change. If we all know, like DST sometimes have disruptions in people's sleep. Here we use this objective sleep midpoint polygenic scores, where the people who have lower scores are more of this morning person, have a higher scores, these evening owls, and we look at these sleep duration and timing before and after in the springtime, the DST onset time. We look at the weeks before and after that. And we found that the evening person actually were affected more than, were affected more than the morning person in terms of both the sleep duration time, comparing their sleep time before and after that DST onset. They have a significant decrease in the sleep duration. We also look at their sleep timing before and after the DST onset, and found that the Sunday, Monday, Tuesday, Wednesday, Thursday, the sleep schedules are similar before and after DST, but on Friday, when the restriction on the schedule set by the working are a little bit elevated, on Friday, the evening person's sleep schedules are much later than the week before DST, disrupted by the DST time changing. So these are some, so above are some analysis is purely based on the observation data. We also did some interventions, wanted to deliver some messages or setting the interns to do some competition, like these types of interventions, and in a micro-randomized trials design, and to see if there's any effects on their mood or behavior. The first one we have done is the message intervention. Just through the app, we are able to deliver messages designed to trying to guide them to do more exercise, sleep better, and maintain a better mood, either driven by their own data, like a data-driven messages, like a feedback thing, or purely non-data tips. And to it was going on for like a whole year, but we take the first 6 months of data and trying to see if these messages have any effect of helping them. We use this linear model with GE and with an interaction term. And this is just a randomized scheme. Like also we found this kind of plot, making it easier to explain how do we randomize each week, whether or not to deliver a message, which type of message, and how this process. Well, we found that these messages does have positive effects sometimes, but that was based on the intern's prior day's behavior. So the messages are more effective if that person's prior day's mood is lower, or if their prior day's steps are have fewer, or they have shorter sleep on the prior day. Then if they have such an intervention message, the message will have some positive effect on their next day's mood or behavior. Another type of intervention we have done trying to deliver is just like setting up a competition between different programs of the interns from different programs. They could compete on either sleep duration or their steps. This is some just like screenshots from what they can see from their app. They can also see some history of the competition in another page. We deliver, if they were randomized into a competition week, they will get in total 4 messages, just reminding them the competition is going to start, and let them know some updates of the competition and final results. This is also a randomized scheme, just like decide whether or not they will join a competition this week and who their components are like, and compete on which content. And we did find that the competition does make the team have a higher steps or longer sleep. But this, in fact, kind of weaken as the time goes along. So it gives some insights of like if someone really wants to set a competition scheme to encourage people to exercise more, sleep more, what's the most effective time window. So far, these analysis has been done by those daily level data. We also have, those micro-randomized trials were collaborated with our guys from biostats department. And we also have some collaborators from math department. They were able to utilize those minute-by-minute data to do some more sophisticated analysis and modeling. These are something they have done just to utilize the minute-by-minute heart rate and steps data to model like the heart rate circadian rhythms, and also extract some basic physiological parameters like the basal heart rate, amplitude or phase variation, or the heart rate increase per steps, stuff like that, and fit some individualized phase response curve. So it's a example of like how you can utilize the minute-by-minute data. And with this thing, I think they further utilize these parameters to apply those in some COVID detection, like in 2019 and 2020 cohorts. And of course, every study wanted to do something with COVID. Intern health study also delivers some additional questions about, have you tested for COVID? What's the test results? And do you experience any symptoms? And because they are medical interns, of course, everybody have been tested. So from the same group, they did to look at, like, from those parameters they extracted from the heart rate rhythms. They tested these parameters before the symptom onset and after symptom onset. And they found that like 4 out of the 6 parameters showed significant differences after symptom onset. That is to say that we were able to, using just like consumer level wearable devices, to detect those physiological signal differences, changes after they have infected with the disease. Our in-house group also have utilized some daily level data to do some COVID analysis. So this one was inspired by a Nature Medicine paper, which claimed that using metrics takes the differences in sleep duration, step count, and resting heart rate before and after the symptom onset could differentiate people who tested positive or negative when they are all symptomatic. So we tried to replicate this results in our sample. And we were actually able to do that and to find out it did have predictive power. However, when we further investigating the details, we found that there are some caveats. The original study did not take into consideration of whether the subjects knows about their COVID test results during the symptomatic period. And we find that in this plot B, that if we remove the days after knowing the results marked by the R, the predictive power reduced significantly. To make sure it was not caused by the data point reduction, we also did a reversed remove the days before we received before they received the COVID test results, and we found out the predictive power was not affected that much. And this is some AUC plot that we can see. You can see if you compare the D and H, the D is that when you keep all the data points, H is when you remove any of the days after they receive the tested results, they have a big reduction. And so that gives us some, just like if you want to do any of the disease detection, just maybe thinking more about different components of the subject's experience. Yeah, so these are some overview of the applications we have done so far. I think that's pretty quick, so I just don't want to be getting over time. A couple of common issues that are emerges in all of this, most of these projects. I think one of the biggest ones is data missingness, especially when you have a larger scale study. You cannot follow up everybody every day. You will, in our sample interns, sometimes if they're surgical interns, they have to take off the watches, and the Fitbit sometimes have the band broken issues, stuff like that. And we definitely will experience data missingness, especially if we were also in our study period is like 1 year. We definitely have some model users, but overall, you can see from this graph, this is graph from our message intervention paper, that at the beginning of the study on week 1, over 90% of subjects enter at least 1 mood score, 70% and 60% have sleep and step and sleep count. But after the half year, these are all gradually dropped to like 50% and less than 40%. So this is a common thing happening in all our cohorts. Some strategies we have been using so far, one main strategy is multiple imputation. Sometimes we also do the main analysis with the imputed data set, but also using the complete case analysis as a sensitivity analysis. Another strategy could be using linear mixed modeling, which can handle the missing data pretty well to some extent. We can also, based on some study designs, set up a completion threshold, for example, like only including subjects who have more than some days of data. You probably want to do some sampling weights or something to overcome the selection bias. A newer issue we have seen in our study is about the wearable device types. In our earlier cohorts, we have solely Fitbit data, which is pretty handy. But as our study goes on, we found that more and more interns, they already have Apple Watch, which is pretty popular among young people. If we don't allow this capability to include Apple Watch, we will lose a lot of subjects. So for now, we are able to collect both Fitbit and Apple Watch data. But before putting them together to do the analysis, we need to look at if the data are similar or okay to combine them. So this is like in the 2021 cohort, we just compare. It's like a daily average of all data points. Compare on the steps, you can see that Apple Watches are actually more conservative in counting the steps. So something good to know, and whenever, if we want to do this analysis with this cohort, we'll think about how to incorporate that information. For the sleep, it's a little bit more complicated for the Apple Watch sleep, because they not only have the first-party sleep tracking, but also have a lot of third-party sleep tracking apps like Pillow or Napbot, or a lot of countless apps can track the Apple Watch or iPhone collected sleep. So which gives us a headache on, if we look at 2020 cohorts data, we see this weird drop in the Apple Watch collected sleeps. And we found out later, just because their first-party sleep tracking was launched at the same time point, around like fall 2020. So half of the subjects switched to use that first part, like the Apple's own sleep tracking, but half of them remain to use the third-party apps. And then if you compare the first-party sleep tracking recorded sleep, they also like more conservative in estimating the sleep duration. So that combining them together gives us a drop in the overall sleep counts in the Apple Watch data. So for the Apple Watch data, you not only need to know it's from Apple Watch, but also need to know which data source, whether it's their own sleep tracking or from other apps. I think that's it for my talk today. I'm happy to take any questions.